I'll get us started. I'm Deneen Scuderi. I'm the Director for Campus Health Services here at NJIT. And I'll start off by saying, since Angela reached out to me to participate in this program, just this morning, actually, I noticed I had 3 different articles hit my inbox about racial disparities in healthcare. So we've known for a long time, and let me back up for a minute before I proceed. The individuals who are here with me, Angela Garretson, Dr. Angela Garretson, who is from NJIT, Dr. Remy Christofferson, who is a Delta Pi chapter member, and Gwendolyn Watts, who is also from Delta Pi. But as I started out saying, we've known for a long time, right, that there disparities exist. But we still are lagging in taking effective action to kind of level the playing field and to address the disparities that we all know are there. I think for educators, if you don't have students, if you don't have staff and faculty who are able to support those students who have health and have a sense of well-being, they're not going to succeed, right? And we know that there is a direct link between health and well-being with academic success. So I think today we're going to go through a couple things that are being done. Unfortunately, it doesn't seem like we're addressing this on the Eastern Seaboard. It seems like from the Midwest over to the West Coast, work has initiated, and we're starting to bring awareness. We need to do that on our own coast as well.
Yes. Good afternoon, everyone. My name is Dr. Remy Christofferson. As stated, I'm a middle school principal. Currently, I'm in Middlesex Borough. Prior to that, I was a principal in Newark for 9 years. So this, the seat that I'm sitting in now gives me the ability to look at education from 2 different lenses, right? I went from an urban setting to more of a suburban community, where my demographics is probably about 85% white, and then minority kind of filter the rest of the percentages. But the reality is that the disparities that we see in urban education hit our BIPOC people harder in communities that don't look like us, right? Because a lot of times it's overlooked. And some of the issues that our students face are sometimes ignored. So, I've realized being in a different setting than I was in Newark, how important my role is as the principal of a middle school, and how important it is for students of color to see and realize that, it's okay to advocate for yourself, right? Sometimes we're silent in a community where it's kind of unfamiliar, or people don't look like us, and you're afraid to ask, right? So sometimes our students are silent. So I think it's important that we empower them. So, that's something I've learned for the last 9 years that I've been in Middlesex, because I struggled, right, leaving Newark to come to Middlesex. It was a struggle for me, right? But, due to family circumstances, I had to move closer to home. But I realize now, my purpose is the same as an educator, regardless whether I'm in an urban setting, right, or a suburban setting. So, that was a kind of an aha moment in my 22nd year of education for me. But, every day it's a challenge. It's empowering. And I look forward to, helping all students, but especially students of color.
Good afternoon. I'm Gwendolyn Watts, and I am a retired 3rd grade teacher. I taught 43 years. 5 of those years were in Paterson, New Jersey, and the others here in Newark. So needless to say, I've taught in the inner city. I think with my take on this is that the racial equity, to my feeling, is that it's intentional. and it's continual. It happens I'm a Southerner by birth. I'm from the South. So moving here, I thought it would be quite different, but but what I learned is that it is the same, but it's handled differently. That where I'm from and where I grew up, I never attended an integrated school. I never had a teacher only of color. Teachers I knew. We attended the same church. They knew my family. Anything that went wrong, it was handled on Sunday morning in front of the church when they told my grandmother. So I learned that I had to respect everyone. It's the culture of being raised by someone who was very old with certain standards and that sort of thing. So coming to New Jersey after graduating from college, I thought I finally hit the big times, that things I'm going to get to go where I want, do what I want, say what I want, only to find that sitting in that classroom in front of me, things had been prioritized differently. Yes, they were all in the same classroom, but some children, regardless of the color, were from different financial backgrounds. I had parents who taught school. I had a lot of parents who worked at Clara Mass. I'd never heard of that in my life, that hospital. I didn't pronounce the words the way they were pronounced here. So I would start with the faculty. That the racial part of it was I found that when I left home, I'm going to go in here and I'm going to sit wherever I like. But that didn't happen, but it was so subtle. So I didn't look at it. I still thought, oh my goodness, I'm in New Jersey and this is just great. But as time went on, I realized that certain students were placed in my class, even though they were on the register in another class. And we would say perhaps they were, I'm going to say, misbehaved, okay? Then we were doing IEP, some of everything, but I found that that was intentional. That's what I meant by that not so equal playing ground. I found that in the South, our books came from another school. They had other kids' names in them. They got new books. We got their books. But when I got to New Jersey, I'm like, oh, look, the book is so nice. And where I'm from, you have to rent your book. Your parents pay. So we have to cover our books, even though they've been used. Here I was covering kids' books, and the other teachers of another color, they were looking like, why did you do that to your kids' books? And so then I realized that my classroom, my desk wasn't new. New desks would come in, and they were placed in another room. Now that sounds petty, and it sounds childish, but then I would ask, where's the fairness of it? Because I taught third grade. We had most years 5 third grade classes. So the kids would say, why is it that they have in Miss Blank's room, they just got this, and in my room we did not? So that's why I use the word continuously. It is intentional and it is continually, but it is subtle. And I think if the resources were equal, because all children can learn, but learn at their own pace. All children can learn, but learn if they're given equal opportunity. So if I'm going to sit in here and have class with you, and this doesn't work, his mic doesn't work, but next door, everything works. But at the end of the year, when the test scores are given, why do you expect my scores to look like the scores next door? While you may not, I do. So that was one of the things of changing. As my sorority sister said, she went from inner city, Newark, to suburban. Well, my students in Newark, 39 different countries, I hardly knew what they were saying. I'm a Southerner, and I speak English, but not the English that you speak, perhaps. I was raised by old people, so that I don't put the end and the beginning on all of my words. And so when I would introduce myself to my parents, I'd say, okay, now you're going to call H2O, you're going to say water, but I'm going to forget and say water, so. And you're going to say the number after 3 is 4. So tell the students when, I'm being observed, that after 3, there's 4. So I have to remember not to say 4. And so if you're going to say equal, yes, we're equal in presentation. We were equal in the number of children in a classroom. But if all the children out of India, we had 17 different dialects. I never knew that. No one taught me that. So in every room you have an aide, and that aide will speak the dominant language that's in your classroom. So then we had pullouts. So when you come to the door to take my students to go downstairs that need help, that you just didn't move to special needs yet, I have 16 kids lining up. The teacher next door doesn't have any kids lining up for that. So is that equal, or are you, like, what do you call that? What do you call that? And our boys and girls, the black and brown kids, can learn anything you want them to know, but they don't care what you know until they know how much you care. And they move closer to you when they feel that you care what happens to them. You have to sit down. There are days that when it's not allowed, that I have to sneak in and comb a kid's hair, because otherwise she will not hold her head up off her desk during class. So is that fair? Is that equal? I let you answer that yourself, but my experience has been absolutely wonderful. 43 years of unimportant lesson plans that were already written in the book. They just want you to write them the lesson plans. I've taught when there were no books, when the books had not arrived. So you don't need the top books that the kids have in the suburbs to teach or to be a good teacher. You just need to know how to teach, when to teach. You can teach a kid to read using a comic book if the other books have not arrived. So that's my take on the equal equity part of that.
Well, thank you very much to my sorority sisters and, of course, my colleague here at NJIT. I'm Dr. Angela Garrettson. And while we come together as a sorority and with our very, very well, I would say, well established in this health area, because she did a lot with COVID at NJIT, and we really set the path for a lot of good work all around this country. A lot of people really modeled and followed what NJIT was able to do. Our report was actually downloaded by more universities. But what I bring to this table is that, number one, the National Sorority of Phi Delta Kappa, founded in 1923, our chapter founded in 1983, 40 years ago, by some just outstanding educators. And Rami and I are very proud that we came in 2013, so we're 10 years in. But our legacy here with this organization truly allows us to be more prepared for our jobs in our everyday. Because what is so helpful is when you are able to pull from intergenerational individuals, and we serve young people in high schools. So every year we have a new group of high school Zenos and Kudos that we work with. So not only do we have experience that really goes the gamut from middle school to grade school to high school, but we're able to really see the changing demographics, we're able to see the changing dynamics of young people, and we're also able to see their challenges when they're trying to transition to what I now do in higher education, to how they can or cannot get into college. So we bring today to this table a conversation that we are a social activist group. We're a dynamic group of so many different experiences and backgrounds, but what we know from our travels and my other role as a elected official since 2013, we have actually seen that in the state of New Jersey, there are no declarations of health. Our topic today is racism as a public health crisis, implications for educators from educators. New Jersey is a state that does not have one declaration for public health crisis. And we're here today to say that we would like to help the city of Newark be the first city to actually create a declaration. And we hope that this is then modeled all around the state and perhaps go to other places around the country. We know it's already happening, and we have a couple of slides and some data points we'd like to share with you. So just to kind of frame this conversation, I'm not going to read verbatim, but if you look at 2018, 2021, and where we're trying to go with this conversation today. So it all launched really in Milwaukee County, Wisconsin, and they were the first community to declare racism as a public health crisis. So just imagine that. We know the time frame, but we also know that George Floyd did not only ignite DEI all around so many universities or so many companies and corporations, but it also really ignited consciousness. And that's what we're here today to show. This data is not just all around other parts of the country, but we want to make sure that it hits right here at our own doorstep. So it happened in 2018. There have been nearly 200 declarations passed since 2020. In 2021, as you can see, 209 of these particular declarations have been in 37 states, but not in the state of New Jersey. So it's just a little shocking. And then finally, we're trying to get to, while these resolutions and formal statements, they may not be legally enforceable, but the reality is if you actually have a declaration, it allows all of us to be on the same page. And very much like the organization that you see present today, we're an organization that's also a national organization, so we're able to really provide this guidance, and then we hope to share that with our sisters all around the country to show that New Jersey, we're doing something tangible, and especially here in New Jersey and Newark. Let's go to the next slide. So there are, across the country, 10 actionable steps that were found from data and reports that were generated. And the report that we are pulling from, my sorority sister will give us the title, but we wanted to just show you the 10 steps that are tested throughout all of the common declarations. And we're going to go through a little bit of data to show you, but the 10 items included data and accountability. It included community engagement, and that's so profound when we think about this topic today, because how are we defining community engagement? Are we engaged in community engagement? And how can we try to make sure that the work that we're already doing can actually be put together in a declaration? Policies and programs, that's always key. Funding. Organizational capacity and training. We heard from the previous speaker, if you don't have leadership and you don't have an organization, it doesn't matter how many programs and initiatives are going to follow, but you really need that organizational capacity and training. It also hits economic development, education, housing, basic amenities in the environment. You hear my soror talk about what her transition from the south to the north and just some of the things we don't always talk about. Public safety and policing. NJIT was able to have some of our public safety officers here today, and that's the point. It's about a holistic approach in health and COVID, which Deneen will be able to speak to. We want to just go by a little details. On the right, you'll see the different declarations that have actually incorporated some of these particular points that we share. But let's dig a little bit deep, and I'll have each one of us will talk a little bit about one of the little buckets. So I'll start with the first bucket, which is create an office group task force for the purpose of data collection. We saw in the presentation we just heard, there wasn't a lot of data about New Jersey, right? We heard about all around the country, but where is the data and who is providing data on this particular area? So one of the key recommendations for the mayor and for all of us to really think about is what are the sources of resources that we have? Who's pulling the data? Who's keeping track of this information? And why are we not keeping track of this information? If we're going to tackle a problem, how are we going to do that if we don't know it? I'll pass the next one to Deneen.
Sure. So creating creator support and office group task force to ensure accountability. And I think the most important thing here is holding people accountable. We can put a lot of things in place, but if we don't implement them and make sure that everybody is accountable for their piece of it, we get nowhere and we just stay where we are. So very important that we have that accountability and that our goals are equitable in nature.
In regards to accountability, develop or improve the collective data and analysis. So as we know, right, what gets measured gets managed, right? So if we're looking at the data and monitoring the data and looking at what's reported, it's important for us to look at and understanding the disparities in the healthcare in regards to our white counterparts and our people of color, right? We see a lot of disparities in that, and it's important for us to hold those accountable that are responsible for this. And it goes as far as research, right? One of the things that we know and understand that a lot of the research prior to, I mean, it's developing a little more, but prior to, most research is done on white Americans, right? Especially females, right? So one of the things that we're starting to see the movement in is looking at people of color, which is important, right? And there's a lot of movement, especially in breast cancer for women of color and the research behind it. But again, I think it's important that we hold those accountable that are in these positions to make sure that the data that is collected is reflective of the people that's represented.
And as far as the educational part of it, the institutional racial inequity, the practices that are brought about with the children, there's, say, a judgment or bias that's used when just by the color of your skin. When you walk in, you don't know what I know. The assumption is that I don't if I'm of color. The educational stereotype or generalization that's done not only by outsiders but teachers as well in the classroom, to be perfectly honest. There reason if a child comes in with glasses, you assume that child needs to sit closer to the front. Is that correct? But the child that comes in hungry, you can't see that. And if they look a certain way, you assume they are going to sit in the back. So again, I keep using that word, the intentional or unintentional bias that's used during the educational part of this is the, no, I don't want to use that word. Let me say, is the not credible, as I say, because if you come to school hungry and it's a day of testing, what will your test scores look like? You don't, the test doesn't ask me, did I eat, or was my mom at work, or did I have certain things? So I think as the reports here, we all know the problem. We know the problem. They're listed here. I have them written here, a whole group of problems. But what is the solution? Talk, as they say where I come from, talk is cheap. It costs nothing. You can talk all day. But until you put it into action, if everyone in every state has put this, some of it, if not all, made the attempt to make it happen, then what do we do? And I would say to those in charge, or the people who can bring this about, if not you, then who? I say that all the time. You talk about it, when are you going to be about it? We've gone long enough talking and talking and talking, so when do we start to develop a type of a program, or to just have the declarations that some of the other people have? Why can't we look at their programs and develop yours? Why can't we say, well, okay, at NJIT, they're doing the foundation, they're doing the groundwork, and we're going to bring in people of color, the people that this affect. And not only that, we're going to bring in their white counterparts as well. Let's have a conversation. You tell me how you came to feel about people of color. Let me hear how I came to feel about white people, and then we will do our declarations, and then we'll come to NJIT once a year, twice a year, and we'll share. Let's put it to work. Let's just not talk. Let's do it. Let's make it happen. Who put your money where your mouth is? Everyone will stand up and say, "Oh yes, we want this to happen. We want equal. We want all of this." And they sit in Washington D.C., Trenton. Okay, you ran for office. We voted for you because that's what you said. Now where is it? Put your money where your mouth is. Don't talk about it. Be about it.
So with that said, as we talk about with this particular conference is developing a report, so we really need to think about, we don't just want words. We really want to make sure that those words of the declaration includes data and accountability, but also including in that, how do we really see the students are impacted as we've all shared. The next one is community engagement. We're going to go a little bit quicker so that we can open it up for discussion. But again, if we look here, the majority of community engagement declarations included engage, collaborate with, and build the capacity of communities of color. So that means no silos. That means that you have to think about how do we actually intentionally, not unintentionally, put communities of color in these declarations. So when we think about a space and place like Newark, we think about the educational levels from really the beginning to you get to college. You really want to make sure that you are connecting the dots and that it's not a silo situation. We can go to the next one. So number 3, policies and programs. Are we surprised that most of the declarations are put equity in all policies? Is anyone surprised by that? So promote an equity in all policies approach for all future policies and programs, or commit to reviewing existing policies and programs. So again, when we think about the city of Newark, we think about school systems, or we think about Board of Educations, what policies actually include equity throughout? So if the system was built in a time frame that excluded individuals, is equity really enforced, and even in higher education? So Deneen, I'll ask you, when we thought about COVID, did you think equity was included across the policies that we were trying to implement for COVID at NJIT?
So, to be very transparent, didn't really think about it. You know, there were a set of things that had to be done, right? But if we look at vaccination, right, we mandated the COVID vaccine when it was available. We didn't necessarily think about, can everybody get access to it equally and readily? Now, we did have some help with that in that we did have a mega site on our campus, which definitely helped us. But no, if I'm thinking about it, no, we didn't think about that piece of it. We knew that vaccines had to be, it was the right thing to do, we believed at the time, and I would still stand by that. But how do we get people equal access to that? I want to say that when you thinking about equity in policies, it's not necessarily intuitive, right? And you really have to be intentional and think of things, think in a way that you probably don't think of right now, right? And I think that goes for everybody, right? We all have a different perspective, regardless of your background. But it's really digging down and making sure and deciding, well, what does this mean? What does equity mean? And what does it look like? And how do we get that into a policy?
Let's go to the next slide. And the next slide is about funding. So I'll hit this to our present principal. When we look at the dynamics here, we saw in 30 declarations, it says secure, commit to, or pursue funding or resources to address systemic racism for the purpose of pursuing equity efforts. In your school system today, do you feel this is happening on that level, and how could the city mayor or municipality or school district secure funding? What type of funding can help reflect strategic actions in this particular area?
So we do have funding that's earmarked to address DEI initiatives in our district. But I think one of the most important things that we have to do first, as you said, is access. Because we use the word equity all the time, but if there's no access, then what's the point, right? So I think that's the piece that's always missing when people talk about equity, right? And I think in regards to funding, the funding is there, but depending on where you are, there's still roadblocks to it, right? There are still people that believe that certain conversations are not necessary in certain districts. So you have to have leaders that are in positions that are courageous enough to advocate for things that are best for children, right? So, the money may be there, but the way you earmark it may not necessarily be for what it's designed for, right? So, and again, it's intentional, right? So you have to make sure that the way in which the money is being used should specifically target the initiative. And I think that's most important, because there are loopholes that you can, unfortunately, do or use to kind of get around the language so that, for lack of a better word, it doesn't cause waves, right? We see unfortunately, the backlash in a lot of districts just when you speak of critical race theory, right? Because people don't know and understand, right? So, people try to get away from those initiatives by backdooring, right, policies or procedures and doing things that actually don't meet or speak to what the actual policy declares that the district should do. So again, it starts with the leadership and providing access.
And our next item was number 5, which was organizational capacity and training. And so this, again, was all over the board a little bit, not so much, but 79 of these declarations across 198 actually identify specific activities to increase diversity, incorporate anti-racism principles across leadership, staffing, or contracting. But we also look at the second highest kind of referenced strategic action was the review of internal policies. I think in this situation, or our conversation today, the one that only received 2 across this 198, I want us to dig a little bit deeper. Promote racial healing through cross-department organizational efforts, truth circles, or commissions. And I'll ask my soror Watts to talk a little bit about, when we think about these different organizational efforts through the years, you've seen politics change, you've seen folks in leadership at schools change. How can you really promote racial healing when you constantly see the evolution of changing in our systems, and the folks who are leading our schools or who are making decisions in our schools no longer always look exactly like they did maybe 20 years ago or 30 years ago? And now that we see those changes, sometimes the change that we see may not be the better change, it's just a change, but we're asking for truth circles. And so just because you have people who look like you, does that mean that truth circles are going to emerge? Do people who have been more diverse create those opportunities? What have you seen in your travels and journeys as an educator, a retired educator, but also one very present in the operations of today? So what could you glean on that particular topic?
I would say that millions and millions of dollars come into school districts every year. Programs are initiated and decisions are made to eradicate all of that, all of the wrongdoing, so to say. But I found that it never trickles down to, I won't say never, to the children where it is most needed. Funding is generated, I think, probably you know better, based on the dynamics of the children, where they live, the need, the socioeconomic part of it. I noticed on the gentleman's presentation today, it had the average salary for a family was $34,000, where the one in Princeton was $154,000. Well, of course, if they are going to receive the same amount of funding as, say, Newark, how that sounds fair because they all receive the same amount, but that's not working because the poverty part of Newark is greater than, you would say, Princeton. And I've watched waste that's the greatest, where millions of dollars are spent on books and materials, and schools were wired for technology, because when all of a sudden when parents, not only you, but the parents are having to use that, they start wiring every school in Newark, but we didn't get the computers for the next 4 years. But in Princeton, I'm sure, they didn't even have to wire the whole district underground and everything else. It was there. So I've watched that so-called funding when parents will say, or not just parents, that all of the money comes into this city and Johnny still can't read. Well, that's because Johnny didn't have a book. They ordered the textbooks, but as he said, the workbooks, which I hate myself too. You try to get through a workbook. They got the text, but the workbook didn't show up. Or the workbooks came and the textbooks didn't show up. So the funding, to me, needs to be, how would I say, maybe not though, because they lie and cheat too. I was going to say maybe corporate America could handle it, but no, that won't work. I think the parents, even students and teachers should have more of an input with when the funding is put in front of you, explained what it is, what it's for, per kid, per what have you. And because over the years, I've watched us do more almost with less. When I first came in this district, we didn't make the money you make now, not that it's a lot. I made $500 a month. So we still got it done. And I don't mean that they shouldn't get the money, don't get me wrong, but funding exists in all places, but the requirement and the resources are different. You can only achieve things when they are fair and equal. Otherwise, you could give us $1 trillion, but if everybody in the front office is going to get an air conditioner and gorgeous oak desk and the students still sitting there with nothing, it doesn't work. I just think that I don't know the answer to the funding, but I do know that something needs to be done because it requires much more than being put into it now, in my opinion, that is.
Thank you. Does anyone want to comment on that one, or we can move to the next one so we can want to get to our 3 minutes. So this one is kind of quick. Economic development, promote racial, economic, and workforce development policies. So again, when we think about these particular issues and we think about economic development, we can't exclude this topic, especially in a place like Newark where we see so many beams going up, and how are young people able to be a part of this, visit this, but also be able to use education to learn from it. Let's go to the next one. 7 is education. So I find it odd that they have a 0 under rezoning for the purpose of school attendance and diversity. We just heard that if we wanted our students to truly have an integrated experience, there would have to be some of our students go and get bused up to Milburn, and then some of the students from Milburn bus down to Newark. Yes.
Attendance?
Yes.
Newark just got attendance, I'm good, just got attendance officers back.
Did they really?
Who was under Mr. Leon. They got rid of attendance officers. You could just be walking the street. She was
Listen, we got a witness in the room. It's,
everywhere. They were everywhere. When I first started teaching, you would see them bringing the children into the building. Now, for years.
so that's an item that we should put into the declaration to affirm that this is something that really does work. So again, because as an organization, but also as we consult with our health professionals, we have to recognize that this is not an and or, this is a both. So next. Housing, basic amenities, and the environment. Again, we know that housing really impacts where you live, what your zip code is, really is truly an important contribution. So when you think about commit to and address safe, affordable housing opportunities in minority communities, we already know we're at a deficit. So the question becomes, how do we build with the other facets of Newark and Newark community and some of the deputy mayors to try to address this, inclusionary zones. So this mayor is very progressive, and there are many programs that he's already doing. So it's just about memorializing it so that it's a declaration that we all can believe in, that we all are sharing, and as an organization, we can really share and go into these schools so that other educators are aware of these priorities. And the next one, public safety and policing. establish external civilian police oversight. So again, NORC are doing these things, but have we incorporated them into an actual declaration? And the answer is no. So it's one thing to talk about it, as we've said earlier, and it's another thing to actually, what are we doing so that the larger masses can be a part of these changes? Because there's a lot of things that are changing in the doings in the district or in the municipality. However, the question becomes, where's that unifying document? Where is that declaration, again, that we're trying to advocate for? And then number 10, the analysis of COVID data. So we know that George Floyd, COVID, it all really hit at the same time. And this is really the only reason that we started even having these conversations. How scary is that? So as we think about the analysis of COVID data, that is a starting point. We started the conversation by saying, where is the data for New Jersey? Where is the data from Newark? It's not that it's not happening, but it's very insular. So the document from the district of data that they're producing, it's for their decision making. But where does that information, if we're saying we want to be inclusive, how are we also working with the universities or working with other districts that are not public, so the publics and the privates or the charters for that matter? So we need to think about that. COVID is a unifying force. It may be a starting place of data that, or maybe not. But the reality is there may be some type of benchmark that we can try to identify just thinking through starting in through that particular experience. So just what COVID and the healthcare industry showed us, because we also saw everyone had to transition from school-based learning to online learning. So even if that's a unifying cry. And then finally, we want to talk about it again in the context of NORC, and we'll conclude with this. We have just 1 minute. Is it 3? It's 3 o'clock, so we're almost done. But there's declarations by geography, type, and strategic actions. So out of the 21 declarations, that included 10 or more actions. So again, in NORC, Janine and I, we talked about it. We don't have to have a 20-page declaration, but we need an intentional declaration. And we need, in some of these declarations, included just one action. So it's not always more. It's sometimes being strategic and intentional. And some of these declarations had no actions behind declaring racism as a public health crisis. So as an organization and a group, we hope that we'll be able to consult with our colleagues, but also include other individuals, maybe some of the nurses from these schools, just to again bring units of individuals together that don't always have conversations and see how we could collectively do this. And this would be the discussion time, but our lunchtime speaker was able to go over, so we're not going to go over. We'll just take what he said, and we'll. But if there's any questions or comments, we would love them.